Oregonians lost their coverage. So they're increasing their profits by 25% by denying people care.
Okay.
My health insurance company wouldn't cover my double mastectomy.
So what'd you do?
And it was clearly covered in my policy, and I spent 6 months fighting them while I was going through chemo, and I did get them to successfully pay. But I think about people who are older, elderly, tired, feeble. How do you go through chemo
Sick.
and fight your insurance company?
Yeah.
We either have a single payer or a public option. There is no reform.
And I could not ever make enough money to be paying for health insurance again. I was dealing with big medical bills because I kept trying to find a solution. I finally got diagnosed. I never went on disability. So, long story short, I did what everyone does that you're never supposed to do, which is I kept pulling money off my equity credit line of my duplex to try to pay my medical bills and bide my time until I could feel better and get a job. Fast forward to 7 years later, I still hadn't found a good job. I was working part-time for nonprofits with no health insurance. And I had taken so much money off my equity credit line that I could no longer afford to live in my home. So I ended up basically kind of homeless for a year. I wasn't on the streets, but I could not afford a place to live.
My name is Gorman. I've been an Oregon doctor for 25 years. To begin with, I'd like to stop for a moment of silence for the 558 Oregonians and the 45,000 Americans who will die this year because they have no health insurance. Murder! I'm here today because I agree with First Lady Michelle Obama. Last week in a speech she said, "This current situation is unacceptable. It is unacceptable. No one in this country should be treated this way. It's not fair and it's not right." That's why we're all here today. It's unacceptable that 45 million Americans have no access to health care. Every doctor, every nurse, every health professional knows it. They see them every day in the emergency departments and clinics in this city. There are treatable conditions they're dying of, but they have no insurance. It's unacceptable that Americans are going bankrupt because of health insurance costs. Most bankruptcies are related to medical costs, and 3/4 of those are people who had insurance when they got sick.
That's right.
Not long ago, an older woman came to the clinic and refused to be hospitalized for acute coronary syndrome. She was in tears as she explained to us that the last time she was in the hospital, she almost lost her husband and her house because of the medical bills she was faced with. She knew that would happen again. She couldn't be hospitalized. That should never happen again. It's not right.
Never.
It's unacceptable that even if you have insurance, the insurance company bureaucrats make all the decisions, not patients, not doctors. I remember vividly joining my neighbor in the street when her son hit his head on the curb. She ran into the house, not to call the paramedics to bring an ambulance, but to call the insurance company to find out if it was okay to take him for health care. That should never happen. It's not fair, it's not right. It's unacceptable that the for-profit insurance industry makes it so hard for doctors and nurses in hospitals to care for people, overloading us with wasteful paperwork and red tape.
Yes.
The situation is that the for-profit insurance industry has failed. And they've failed badly, year after year. We don't need a trigger mechanism. How much worse would it have to get than it is now?
We can't wait.
It's like big tobacco. They're selling a product that's bad for us, that's harming Americans.
Yeah, exactly.
Like
they're
big
sucking us
tobacco,
dry.
They will fight hard to continue to profit at the expense of the rest of us. Like big tobacco, they won't fight fair. They'll misdirect us, they'll play fast and loose with the facts, and they'll give millions to politicians in both parties to make sure they continue to rake in billions while they continue to do nothing for the health of America. Meeting with Congress people, they're hearing from 6 lobbyists per congressperson. They need to hear from you and your friends. So let me quote Dr. King. History will have to record that the greatest tragedy of this period was not the strident clamor of the bad people. We've heard about them in the town hall shouting, right? But the appalling silence of the good people. So it's time to call your congressman, write your congressman, and fax your congressman, and tell them to support the health reform that ensures the basic.
45,000 Americans will die this year for lack of health care. 700,000 will go bankrupt because of medical expenses. Millions more are one injury or illness away from disaster in their families. That's the legacy of the for-profit health insurance industry. What if we had a health care system that covered everyone?
Cross got me hungry. My new Blue Cross policy. Blue Cross said that I'd be happy with Blue Cross over me. And I got then a very high fever I ran. Blue Cross said I had the wrong plan. And I took a fall, leg and a splint. Blue Cross said to me, read the fine print. Oh, Cross. Blue Cross. I don't know what to say about these guys. Blue Cross profits off me. They're driving me into bankruptcy.
Big insurance, sick of it.
We're doing it for him.
Uh-huh.